Hello, I'm Dr. Shashi Rawat and welcome to my channel Metta. I'm a medical acupuncturist specializing in chronic pain management and women's health by employing an integrative therapy approach to improve well-being and build vitality. I was diagnosed with polycystic ovarian disease at the age of 18 during my first year of medical college. At the time, the only symptom I had was irregular periods, and frankly, I couldn't have cared less. I guess it's easy to possess an aura of invincibility as a teen. Moreover, if you were a student in the early 2000s, you will relate to me when I say my identity at the time was strongly defined by how I was doing academically, and health wasn't really a priority. My mother, however, was much more concerned and took me to a gynecologist who advised an ultrasonography which revealed multiple immature follicles in both ovaries. I was started on oral contraceptive pills, and I remember a close family member asking if I was already sexually active to be taking these. This was in 2004, and unfortunately, the taboo still exists. The pill regularized my menstrual cycle, but as college work got busier, I discontinued its use after a year or so. Periodic bouts of acne, a 35 to 40 day menstrual cycle lasting for 3 to 5 days, a difficult premenstrual syndrome all became a norm for me. I was never active in sports, but being a medical student with clinical work meant being on your feet for the most part of the day. Hostel food was decent, but owing to the obscure location of our college, the closest thing we had to eating out were Kayendi Bhavans, or as we call roadside eateries in Tamil. I was neither skinny nor overweight and just comfortable in my own skin. I distinctly remember having just one lecture in our gynecology curriculum about PCOD. We knew that it was a result of hormonal imbalance with genetic predisposition causing excess male hormones in the body and could lead to infertility. The treatment of choice then were oral contraceptive pills, anti-androgen drugs, and metformin. To be candid, after an embarrassing incident, I happened to announce in class that I had PCOD and feeling engulfed in shame, thinking if I would be perceived as less of a woman. Now looking back, I feel my journey of self-discovery and self-love began there. Being away from home, on my own, understanding that the world is a difficult, chaotic place, oftentimes making you doubt yourself. I decided I'm not going to let myself contribute to that. So instead of internalizing that toxic emotion, I was okay with being vulnerable and not see it as a sign of weakness but as strength. The perspective also shifted from just talking about the issue to having a more solution-oriented approach. I remember before getting married, having a serious discussion with my husband about my PCOD and how our chances of facing fertility issues would be higher than an average couple. I wanted to know where he stood on adoption and us becoming parents that way. But as it turned out, after a missed abortion, I conceived naturally and gave birth to our first son. Living with PCOS for more than 15 years and helping women across different age groups with the same for more than a decade now, the most valuable lessons I have learned are as follows. Number one, if you are a woman with any menstrual issues, be it excruciating pain, debilitating premenstrual syndrome or PMDD, not getting your periods for months and then bleeding for more than a week, it isn't okay for you to suffer. Oftentimes I meet women who have passively resigned to this suffering. In the past, I used to be in the same mind frame, but understand that this isn't normal and doesn't have to become a way of life. There are treatments available, changes that you can make which will help improve your sexual and reproductive health. Whether it is PCOS or hypothalamic amenorrhea, step one is to regularize your periods. Number two, find a doctor who can help you arrive at the right diagnosis through clinical evaluation, which is later supported by biochemical assessment, that is blood work to check your hormonal levels, as well as imaging techniques such as ultrasound. To also then figure out if you have any other associated issues such as hypothyroidism, inflammation in the body, insulin resistance, or are experiencing high stress levels as evidenced by elevated DHEA levels in your blood. A diagnosis tells you what it is exactly that you're dealing with, and your lab work gives you a starting reference point. PCOS presentation in every woman can be so varied that in order to come up with an effective treatment plan, this starting reference point is crucial. Let me also point out the importance of finding a healthcare professional with whom you can discuss your health issues freely without feeling judged, whose guidance you trust, and whose treatment combines what is medically needed for you and is in concordance with your specific health goals. Number three, choice of treatment. I tell all my patients dealing with any chronic health issue that this is a lifelong condition heavily influenced by their lifestyle, and hence they are in the driver's seat. As a doctor, I can help guide them, but this is going to be a team effort. There is no magic cure. Multiple factors contribute and trigger this disease, hence a multifactorial approach is required to treat it. With your doctor, sit down and write your specific health goals and formulate a treatment plan which may include a nutritionist, a fitness expert, a psychologist, a dermatologist, or a fertility specialist. I know this may sound overwhelming, but know that this is the first step to understand your PCOS and your health goals in order to lead an enriching life. Even if you feel consulting with all these specialists may be economically unfeasible, you would know which healthcare professionals to follow on social media, what sort of scientific articles to read instead of following just generic PCOS advice. When you employ their suggested changes and are still not seeing the desired outcome, then maybe it's time to invest in a private consultation. Number 4, educate, apply, assess, and tweak. Periodically assess how your body is responding to a particular treatment or a lifestyle change. This can be seen in terms of clinical improvement. That is, you would start to get your periods regularly, your energy levels would improve, you would sleep better, reduction in acne or hirsutism, as well as biochemical proof of your parameters falling within the normal range. For me, this is as important as diagnosis and treatment, because oftentimes I meet patients who have been on a treatment for years with not much improvement at all. Still, they don't pause or evaluate and continue thinking that they are doing at least something to tackle their problem. So take a step back every few months or so and assess how well it is working for you. Number 5, know where you are. Similar to most chronic health issues, I find PCOS also to have an active and a dormant stage. Some women are completely averse to taking any medications and tell me that they wish to treat their symptoms naturally. I wish I could say it was that simple. But again, it comes down to your age, the type of PCOS you have, and your health goals at the time. For example, let's say you have an insulin resistant type PCOS, are in the active stage and are looking to conceive. So along with focusing on improving your nutrition, fitness, and better mental health, seeking active medical treatment will help you both manage your condition and conceive in an expedited manner. On the other end, if you are in the dormant stage with no contributing factors to flare up your PCOS symptoms, just maintaining a healthy lifestyle would suffice to keep it under control with no medications. So to summarize, write down your health goals. It could be regularizing your periods, improving your energy levels with less cravings, better mental health, getting rid of acne or hirsutism. I am 36 years old with 2 kids dealing with occasional fatigue and a strong family history of hypertension and type 2 diabetes mellitus. So my current goals are to avoid these conditions and to feel physically and mentally strong. For me personally, I have observed the biggest trigger that pushes me into an active stage is poor management of stress. The COVID pandemic has possibly been one of the most stressful times of all our lives, and my PCOS symptoms have flared up too during this period. I fully subscribe to the thought process that pandemics are portals, transporting us into a new world, breaking away from the past. This is probably why I'm sharing my story with you while I'm on the road to recovery, to let you know of the challenges that I face and how I'm overcoming them from learnings of the past. I will share my experience with nutrition, workouts, how I practice self-love, my pregnancies and postpartum period, how I use acupuncture to manage my symptoms, and share a few printable guides that you may find useful. My philosophy involves focusing more on improving health and fitness than on the disease. So essentially, shifting the outlook to how you feel and function will automatically enhance how you look. Whichever topic I discuss, my key message is to emphasize the importance of being well informed, to possess a degree of self-awareness about your own health, what works for you, what triggers your symptoms, but at the same time to set realistic goals. To be kind to yourself in the process, and to know that this is a journey of learning, understanding, and nurturing your body and mind. Please watch the series in its entirety so that every information is taken in context to the subject being discussed. Thank you for your time and attention. Be well.